Hi, my name is Suzanne Wallace. I'm a nurse practitioner. I've been practicing for 10 plus years, and I have a new medical office located close to downtown Winter Garden in Florida. I focus on primary care, but I also specialize in hormone replacement therapy, especially for the perimenopause, menopause, especially since I've been going through it. I have done a lot of research and found what works best and have been working with patients, helping them to feel better. So I'd like to share my knowledge and just put some input out there. So basically, I feel like we are afraid of hormone replacement therapy, probably because of that study that was done back in 1990, the Women's Health Initiative. Since then, that hormone replacement therapy can actually be very beneficial for the females. It does help with cardiovascular risk. It helps keep those bones nice and strong. The osteoporosis risk increases at 60. That's why we do those bone density scans at 60 to make sure there's no osteoporosis, osteopenia, all that's so common, mostly in women. And it can be prevented if you don't have a menstrual cycle. Even in perimenopause, you can start estrogen, progesterone, and testosterone. Those are the three main hormone therapies that, as you age, we get deficient in those three hormones. So by replacing them, you can start off low and small. There's different forms, there's different methods of receiving the replacement therapy, but it does help prevent breast cancer as well. It helps the cardiovascular system. The bones stay nice and strong. So this is all the things that we're finding out. So throw away what you learned back in 1990, early 2000s. That study has all kinds of flaws that we've found out now. So I remember when my mom was going through menopause, it was don't take those hormone replacement therapies. This was 20, 30 years ago. And, I just hate that that is the stigma that's still going on today. But basically, you'll have your estrogen and that gets low. You need to replenish that, and there's ways to do it. So because of those clotting risks, we don't take the oral pill. As you get older, it can be safe in some females, and they don't have any issues with the pill form, but it's a little bit safer as you age because of the clotting risks. So by doing the cream, just rub a little bit of cream, tummy, shoulder, whatever works, or do a patch, and you basically put the patch like on your lower abdomen, and that helps get the estrogen into the body. The patch you can change it 2 times a week, once a week. There's different prescribed methods. There's also from the compounding pharmacy, they have options as well. Or you can get it from your local Walgreens, Publix, CVS, so they have that as well. There's also progesterone, so that decreases as you age as well. Perimenopause, menopause, those numbers go down. Progesterone can be safely taken in a pill form, and you do it at nighttime, and that does kind of help with your sleep. Yeah, so the backtracking, estrogen can help with mood swings, help with anxiety, any kind of depression, sadness, anything that you have there. With the moods, it helps with brain fog, all kinds of those menopause symptoms. The list goes on and on. Progesterone's more for like your sleep, so you take it at nighttime, and it does help with the sleep. So progesterone and estrogen work well together. Even if you don't have a uterus, I would still recommend taking the progesterone if you're having trouble sleeping. If you do have your uterus, like if you've never had a hysterectomy or anything, then you have to take the progesterone with the estrogen. There's also testosterone. We don't think of testosterone for females. We think of it as, oh, it's a male medication. But it's actually very beneficial for females. It helps with anxiety, depression. It helps with your moods. It helps keep those muscles nice and strong and helps keep those bones strong too. So testosterone is a bioidentical hormone replacement therapy for females. The availability for the testosterone, it's not going to be covered by health insurance. You'll have to do a self-pay, but you can take A gel, the testosterone gel that's prescribed for males, can safely be given to females in a pea size, a very little small amount, 1/10 of the amount of the male. What the male gets, we need 1/10 of that. So just like a tiny little small amount, rub it on the shoulder, switch sides, wash your hands afterwards, on the tummy, whatever works, just as long it absorbs into the body. And take that in the morning, and that helps with your energy, it helps with your libido, helps with all kinds of things. So the male gel that we can get prescribed for us. So just kind of a recap: estrogen is available through the patch, cream, or even a pill. Progesterone is pill, and that's taken at nighttime. And then the testosterone can be the cream, gel, injections. So those are the three hormones that we need to replace and replenish as we get into perimenopause and menopause. If you haven't had a menstrual cycle in 1 year or longer, you're in full menopause. If you are having any of the symptoms of menopause, such as the brain fog, the anxiety, the depression, the hot flashes, the difficulty sleeping, the brain fog, all those things, if you're having all those things, but you still have a regular cycle, check those hormones. Let me know how I can help. I'd love to schedule an appointment. I have my website listed below. Please ask any questions below, and I will be happy to get back to you. Thank you so much for listening. I hope this was educational. If you have any further questions, let me know, and we can do some more discussions. Thanks.